over a prolonged period of time. Basically, your lungs, alveoli, all that kind of stuff have an increase in friction, which causes a breakdown, which causes scar tissue. Scar tissue is not as elastic, thus causing distension and loss of elasticity in your alveoli.
Gotcha.
Because of this, the alveoli grapes stop being grapes and start becoming a grape.
A grape.
A giant one
So
grape.
basically, you go from this to a distended this.
You lost elasticity.
Yeah, and so your capillary beds run here around these. And so whenever it distends like that, this capillary bed, this capillary bed, this capillary bed, that capillary bed aren't touching. That one might be. And so that's what causes the lack of perfusion.
Yeah, poor kid, okay.
And that's why patients with COPD, whenever you're talking about SpO2 ratings, in 88 is okay because they're on a hypoxic drive rather than a hypercarbic drive, thus causing that drop. I lost.
So you lost the eraser?
There's some there. Anyway. I put it over there. Touche. Thank you. All right. Emphysema, damage, any kind of activity or habit that causes scarring or damage to the lungs or alveoli, cause it to build up scar tissue and not be able to extend, right? Big symptoms: barrel chested, perched lips, difficulty breathing with minimal exertion. That's the whole thing, is they have such a low oxygen content to their blood because of alveoli being messed up that they're not able to maintain, that they're not able to maintain normal SpO2 levels.
Headed.
And a big thing is because of the distension and them not being able to control, the alveoli not being elastic, not being able to expand and contract, they're going to have difficulty on exhalation. So they're going to be going and they're going to be breathing in, and then in order to get the air out, because there's not a whole lot of muscle and they're not really helping him out, he's going to have to go. And that's why you get the thin barrel-chested appearances, because his accessory muscles are going to be used so much during exhalation.
Okay. Now, so I know pursed lips is a symptom of it, but what is it exactly?
What?
Pursed lips, like. No, I know what it looks like, but can you like?
Peat positive.
Why they do that? Because that's them helping to expel the air. It's just what you do to help push it out. That's why prolonged exhalation is also one of them. The perched lips go along with that.
Okay.
Because of the difficulty, because think about it, like whenever you're trying to like breathe out quick, do you go, no, you go, and you try to push it out like that. All right?
Doesn't it also make exhalation active instead of passive? Or
Yes.
No? It does?
Yes.
Okay.
That's the accessory muscle use.
Yeah.
That's why you get the barrel chest and the sunken clavicles, all that shit.
Gotcha.
All right? Age group, they're going to be older, prolonged exposure, smokers. What?
60 or 70 skinny.
60, 70 skinny. They're gonna look like shit because they have to breathe more than they're able to actually put out their eating. All right? Meds and treatment. What, I got CPAP on there? Maybe not. Because they're so weak.